Hi, my name is Mike Hodges. I'm the Managing Director of Healthcare Consultancy at Christie Co. And I'm delighted to be hosting Joe O'Connor today as our guest for Christie Co's 2024 Business Outlook. Joe is the Chief Executive Officer, supposedly in an interim capacity of 4 seasons, but you've actually been there for 2 years now, Joe. How time's flown by. He's known to many also as a senior member of the UK restructuring community. He has a current role as a Managing Director and partner at Alex Partners, a global consultancy practice. So delighted, Joe, to have you here. Welcome.
Well, thanks, Mike. It's great to be here.
Now, I think we first worked together probably around 2013 on a job called Akari. Where did it all start? What was your sort of first big break into healthcare?
It started for me, Mike, just after the global financial crisis. And I would say actually it got turbocharged by working on the distress of Southern Cross Healthcare PLC, which was obviously a major situation in our sector in about 2010.
So what was your role in the Southern Cross restructuring then?
So when Southern Cross was getting into distress, you'll know, Mike, its landlords started to realise that and started to organise and get together. I was acting for NHP, which was the largest landlord of Southern Cross. We had 250 of the 750 care homes. So it was really important that we helped stabilise those homes. What we did was we worked with Southern Cross initially with a landlord committee, which we helped form to bring all the landlords together and find a landlord designed solution ultimately, because we felt the solution the group was coming up with wasn't going to work. And ultimately, the landlords largely took the care homes back in-house or placed them with other more financially stable operators. In the case of NHP, we decided to create our own operator and actually from scratch created a business that's now called HC1, hiring Chai Patel and David Spruzen, and being involved in that at the very start, helping that business be conceived, created, grown, regulated for the first time, and go on to the success it's had, I think was a fantastic opportunity to be involved in.
What were the key challenges of that process, and how have you seen the sector sort of moving forward from those days?
Well, the key challenges then were, there were many challenges in the sector at the time, weren't there, if you cash in my back 15 years or so, many of which are common today. Obviously, fees were just fundamentally not recognising the true cost of care. That business was significantly underinvested. It just didn't have the cash flow to invest in its homes. It had rents that were going up by at least 5% per annum, when ultimately its revenue line wasn't. And so there was a dislocation between its top line and its cost base, ultimately, and a business that was entirely leasehold, which was a significant challenge. And it came after a lot of CMBS structures and a lot of sale and lease back in the sector. Some of those challenges are common today. Some of them, I think, less so. We've learned some lessons from that time.
It was a fascinating project, and I can remember we were also involved when HC1 was established, and we had to help the new management team actually understand what they'd inherited. And many of the homes, I think, had suffered from a lack of capex, and probably themes that we continually see in the sector, Joe, to the present day, mainly because of local authority funding challenges. Do you think the local authority funding picture has improved since the Southern Cross days? We've seen a bit more improvement more recently, but what's your take?
We definitely have seen an improved picture, but by no means as improved as it needs to be. I think there's a lot more talk now, clearly, of fair cost for care. There's a lot of reviews on fair cost for care. And that's definitely better. I rember going back to our Akari days in the sort of mid-2010s when, frankly, providers were launching judicial reviews against local authorities because the fees they were paying were so fundamentally unfair. We're not in those days today. We're definitely able to have a more constructive discussion with our local authority customers. But it remains, certainly in some parts of the country, a challenge to make sure that we are getting the fair cost of care.
No, very interesting. And just to finish on Southern Cross, I think one of the big success stories was that there were no home closures through the process, and that was obviously a huge achievement for everyone involved with it.
Absolutely, and I think that was so important, not just to the landlord committee, which I was a part of, but also the broader restructuring committee, the banks that were there at the time, the management of Southern Cross and their advisors. It was important to everybody that the residents were protected first, that the jobs were transferred. Over 40,000 people work for that business, and that those jobs were transferred safely. And ultimately, of course, for the landlords, that the value in our care homes was protected. And I think it was a testament actually for how the industry, both in social care but also the restructuring industry, came together and achieved that result.
What would you say then has been your career highlights working in social care? Because that was obviously a huge job then. You've got a job that's possibly even bigger, what you're doing at the moment with 4 seasons. How do they compare?
Yeah, are you allowed more than one highlight? I think certainly for me, I'm very proud of not just what we did at Southern Cross, but actually what we created in HC1. And I stayed with that business for 3.5 years, from its conception through to its successful, full turnaround and sale, which was delivered by a fantastic management team led by Chai Patel. That was definitely a moment of real pride. Coming back though to now, I think I'm most proud of what we're achieving at Four Seasons Healthcare. I've come into the business in very late 2021, and as you say, been in place as CEO now for just almost 2 years. What we've achieved in those 2 years from a fantastic team that I have, both inside the company and with the support of the AlixPartners team, I think has genuinely been industry leading. I'd love to talk a bit more about that.
How did you first get involved with Four Seasons then?
So I first got involved in 2017 for a few years, working on behalf of the secured lenders and working very closely with the group. And that was a very rewarding experience, although ultimately we weren't able to restructure the company at that time. I was then asked to get back involved when I arrived at AlixPartners in late 2021. And I was appointed to the board on New Year's Eve 2021 at 8 p.m. So it was a way to sort of finish the year off, and began in earnest at the very start of 2022. And I became the Interim Chief Executive of the group in March 2022.
Could you just explain some of the initiatives and sort of key focus areas that you've been trying to address to improve the performance of the business?
Absolutely. And the business was in a reasonably challenging operational place in 2022. Part of that, of course, was the impact of the pandemic, which, although it had finished by that point in terms of lockdowns, as you know, Mike, our sector has taken a long time to recover. The reduction in our occupancy was fast and was very, very significant. The impact on our colleagues, on our ability to bring people into our care homes, to move colleagues around our care homes, was severely constrained. And it took a long time to recover both the top line and the operations of the business, but frankly the government support for the sector ended very quickly. So there was a disconnect there. So we took a long time to turn around the business through 2022 and 2023. I'm very proud of what we've done there. We tackled a very high agency labour reliance that Four Seasons Healthcare had, which we no longer have today.
What's your sense on the degree of challenge that we have from workforce at the moment compared to how it was, say, when you took over?
Well, we definitely still have a significant shortage of skilled workers in social care, and that hasn't alleviated and probably won't alleviate anytime soon. There's lots of reasons for that, and not least the change in the ability for labour to move freely around the European Union when we were a part of that. We definitely do have more people coming in from further afield, as you say, Mike, on sponsored visas. That has a cost and a significant time to bring those people in, and of course the government's recently changed the rules. So I don't think it's necessarily much easier. It probably is a little easier than it was. I think in the business I run, we were more focused on removing our reliance on agency, making sure we had the right staffing levels, absolutely always. But probably there was an element of comfort blanket staffing that had developed through the pandemic in our business, which was able to be taken away very safely. I think also where I focused on is the culture of the business, creating a culture that people really want to be a part of. One of the things I'm most proud of is we have a lot of what I call boomerangs, people who left Four Seasons Healthcare, but actually seeing what we've achieved in the last few years, they're coming back. That's absolutely fantastic, and I'm really proud that our staff attrition has more than halved in the time over the last couple of years. So that's something where we're really focused on retaining our core staff, on also really getting the advocacy from our teams so that they're recommending to their friends and families that we're a great place to come and work.
Can we talk about the residents that you're looking after then? It's sort of interesting to hear where you see occupancy now compared to perhaps where it was when you took over. Do you think we've got the recovery now through from the pandemic? And also the acuity needs of people coming into the homes. I'm hearing from others that people are coming into homes perhaps with higher acuity needs than they once did. Is that your experience?
Firstly, on our occupancy recovery, it's recovering well. It's been slower than I would have liked, but it is recovering very well. And in fact, in many of our homes, occupancy is now back to at least pre-pandemic levels, if not better. Certainly in some areas, that recovery has been a little slower. At times deliberately so in our business. I want, frankly, to bring the right residents into our homes where I know we can deliver the right care that they need. I don't want to bring residents in for the sake of it. I also want to only bring in residents, frankly, where it's for the right fee and the cost of care is properly reflected. So we've been focused on rebuilding profitable occupancy, and that has been a little bit slower than probably the ability to build occupancy for the sake of it.
And you mentioned fee rates. Where do you think fee rates will be this year? We've had some pretty reasonable increases in the last couple of years. Do you think we're going to see that maintained this year in terms of what you're hearing from the local authorities that you're in discussions with so far?
Well, it's quite early for the local authority discussions for the year from 1st of April 2024 in England. But certainly I think it's important that the fee rates do continue to reflect the cost of care. And whilst we've had two much stronger fee rate increases across the sector in the last couple of years, that was much needed. And by no means do those strong increases in 2 years compensate for many years of increases that didn't reflect the cost of care. So I do feel that it's still important that we get fair settlements out of local authorities this year. Obviously, the national living wage drives a lot of the cost base in the social care sector. We often pay much better than national living wage, but we do have pay differentials that link to that, so it's relevant for our cost base and our payroll and our agreements with our trade unions. That went up an unprecedented almost 10%. So I think there's lots of strong arguments for another year where local authorities need to recognise that they need to pay a fair price. I think we have to, of course, recognise local authority finances are in a very challenged position.
Does that concern you? We've had some big news with some of the biggest authorities in all kinds of difficult places at the moment. Are you seeing any impact of that in terms of referral levels or conversations around maybe changing care packages to save money?
No, not at the moment, Mike, but just coming back to a point you made earlier, I think what we are seeing is the acuity level definitely increase. So commissioners perhaps deferring those commissioning decisions where they feel possible, perhaps in our view deferring for a little too long. Now, in some ways that's okay as long as when residents come in with higher acuity of needs, that firstly we're the right care home to support them, or wherever they go, it's the right care home, it's got the right nursing support, for example, if it's a nursing resident, and it gets the right fee to reflect that cost of care. But certainly we're seeing commissioners change those behaviours and commission later. I'm not yet seeing commissioners not commission at all. And I think in terms of this year, the outlook's still unproven because it is very early in the cycle.
So Joe, over the last 2 years, we've both been very busy with the sale process, and that's obviously pivoted in some interesting directions, and you now have a core of homes that you're retaining as a business with a strategy to hold, enhance and move that side forward. Does that excite you? What are your big ambitions for that portfolio?
It excites us hugely, Mike. It's a fantastic portfolio, and I actually brought the business together just a few weeks ago in Manchester for a conference of about 100 of my people. And the enthusiasm in the room was just, electric. We have a really good core portfolio of Four Seasons Healthcare and Brighter Kind Care Homes, which we've decided not to sell in this sales process, as you say. The KPIs are excellent. Most importantly, the care quality. I'm really proud of that. Always more we can do. But if you get the care right, everything else follows. So we're focusing on excellent care quality. We're focusing as well on creating a culture of continuous improvement in that business. That's been a really big theme for me over the last couple of years. We have excellent employee retention, as I said, and we're really pushing around advocacy, having our colleagues recommend us to their friends and family and other people they know who work in the sector. And ultimately, strong financial results will follow that. It's a great business. I'm really excited about the future. Let's see what 2024 brings. But we have a really strong ambition for continuing to take that business from good to great.
How's it been to run the business though whilst we've been going through the sale process? It must have been a very careful balancing act in terms of doing what needs to be done to transition the homes to new owners, whilst at the same time retaining that core enthusiasm, that energy, that focus of your core team.
Yeah, it's been an interesting time, Mike, as you say, and I think what's been great actually though is balancing an operational turnaround, a culture change, and really just reinvigorating that business after a number of challenging years and after a pandemic, which was unprecedented for our sector, with what has been quite a fragmented, but deliberately so, a fragmented sales process, which has involved an awful lot of work, collective work from Christie Co, from Alex Partners, from people at Four Seasons Healthcare, and from our legal advisors and many others. And I've really enjoyed it, if I'm honest. I've really enjoyed the juggling of those competing priorities, but they're complementary priorities, frankly. And obviously the fact we have improved the business's performance through that sales process, I think is very helpful. It's been difficult at times saying goodbye to colleagues. We've transitioned many of our homes to new owners. We wish those homes and their new owners well. We've done it in a way that's tried to be as careful as possible, as focused on our residents as possible at all times. Our residents, the care quality they get, the experience they get, because this is their home, has absolutely always come first and will continue to do so. But I think we've hopefully, managed that balance well, Mike.
A lot of people will also know you for your work as a restructuring professional, and maybe just talk a little bit about what you do at Alex Partners and what Alex Partners does.
So I'm a partner and managing director at Alex Partners. It's a global consultancy, as you say, and in my part of the business, we're focused on restructuring, on turnaround, on performance improvement, and in my case, working with companies and trying to understand elements of distress or stress and provide operational improvement, provide financial restructuring support and advice. But what I also love about Alex Partners is we actually roll our sleeves up and get very, very hands-on. We're senior teams that get involved. And in this case, as you know, on Four Seasons Healthcare and many other situations we get involved in, we will go on the board to really help drive the change rather than just advise on change. We roll our sleeves up, and I love that, and I think that's been a big change for me about being at Alex Partners for the last couple of years.
And I think Alex Partners as an organisation have been very focused on ESG, and that's been a sort of key part of your values. Could you just talk about that a little bit in terms of ESG at Alex Partners, and maybe also segue into how you see it impacting on the care sector, as investors it seems to be their favourite word at the moment.
Yeah, it is, isn't it? And clearly it's very important, and certainly in professional services firms, in Alex Partners in particular, it's a very big focus. We're already carbon neutral, for example, and just making sure that we're thinking about not just our environmental footprint, not just about working with businesses that have the right values and sustainability, but also, frankly, the governance aspect of ESG doesn't always get as much focus. That's an area where we provide a lot of support, and frankly, strong governance, good governance is great for UK PLC and great for our economy. In relation to care and social care, certainly in the businesses I've worked with over the last 15 years, there's more that needs to be done. As you say, it's become very important to, frankly, to the general public, but definitely to the investor community. It's coming up more and more in whether banks will lend to a particular company, whether investors will buy into a particular company, and obviously it's very easy around new builds to change the way in which you build a care home. Where it's much harder is, of course, most of our care home stock in the UK was built some time ago and was not built at a time when the current standards we have for building and for the environment and for sustainability were in place. So there's a lot of retrofitting and a lot of catching up to do across our sector, and our sector's highly fragmented. Much of our sector is owned by mom and pop operators. And so I think actually this is an area where probably government needs to think a bit harder about the amount of social care stock in the UK. Ultimately, it is, I think, housing stock generally that's one of the biggest opportunities to transition to a greener economy. I'd like to see the government think more carefully about how they could help our sector invest to achieve that sooner.
What are your expectations for the healthcare sector in 2024? What do you think is most likely to happen? We may have an election, so there could be some political change.
Yeah, I mean, I think it's going to be a very interesting year, but so is every other year, frankly. I'm not sure personally the general election is as big an issue as some people feel. I think with potential change of government, one can always look at what a potential new government might do, and actually just looking at Wes Streeting in the Labour Party, he's talked a lot about the social care sector, a lot about the broader NHS. There's the Fabian Society report. There's a lot out there that might give you a sense of direction of travel if we do get a change of government. Probably more actually than what the existing government would do were they to continue. I think in terms of 2024 more generally, I see this as a year when there will be stronger transaction activity, whether that will be as early as Q1 or whether it's perhaps more sort of Q2 onwards that sentiment recovers. But certainly the sentiment that we've had in the sort of at least most of 2023 and certainly closing out that year, I think is turning. And so I think that will be good. I think equally there's a lot of transactions probably to come in our market as a result, because there's been a number of transactions that have taken a very long time. So I think as someone who focuses on transactions in the social care and healthcare sector, like you yourself, Mike, I think this will be a very interesting year. I think it will be a slightly more economically stable year, which is good. I'm not looking personally to go back to September 2022. I think equally, my focus is also on just the operational basics, the disciplines, not losing track of those. I think particularly when an environment gets slightly easier, that's when businesses start to make mistakes. Well, I won't allow the business I'm involved in to do that, and we'll keep disciplined, we'll keep very, very focused on how we run our business well through 2024.
Where would you see the main opportunities then for the year?
I think there's still opportunities around staffing, around becoming an employer of choice in the sector. I think for our sector, there's more opportunity to continue to sell why we are a place to build your career. I'd like us to have stronger career paths in the social care sector, and we've been working on that in Four Seasons Healthcare around care, care as a profession and treating it as a profession alongside the nursing profession that we obviously have very significantly in our sector. I'd like to continue to see a lot more integration between health and social care. It may be one government department, there's still an awful lot more integration that could be done. And frankly, I'd like us to come out from being the second fiddle to the NHS, Mike.
I think we're all on that page, and I think it's fair to say that the pandemic probably increased the social status and standing of people working in the care sector. Obviously, it's a very difficult period, but you go around care homes, and I'm always inspired by seeing a manager that started perhaps as a baseline care assistant that's worked their way up through the ranks.
Instantly, as you say that, I think of Alex at Kingston, for example, our manager there, who joined at that sort of level and is now managing one of our best care homes in Kingston. We're incredibly proud of what he's doing. He actually helped me in organising the conference I mentioned before. And it's a big aspect for me in Four Seasons Healthcare about career progression. The leadership team I have, which I'm incredibly proud of, largely I've promoted from within in my 2 years. Taken the right raw materials and given people support to grow their careers. I think that's what this sector could do more, and it will then help us because historically our attrition has been very high. And we're retraining people constantly. So if we can be more of a destination career in the UK, as well as bringing people in from other countries, I think that would be a big impact on all of us in 2024. That's quite an exciting opportunity.
Where do you think we'll be in, say, 5 years' time as a healthcare industry?
I hope we'll be a lot more integrated. I hope that when it comes to winter pressure, we'll have a very slick, very well-established system for genuinely integrating our health and social care systems such that we can alleviate winter pressure in the NHS, support the social care sector, and ultimately have residents and patients in the right place for their needs, which we don't always get right today. I think if we can have that integrated system, that would be great. I think also in 5 years, we have to have dealt with the long-term funding crisis. We have to stop kicking this can down the road. It's been kicked down the road by governments of all political colours. And I would like to see the next government genuinely take social care seriously, genuinely think about ways to develop long-term funding models, whether that's savings, insurance, whatever models we can think about and learn from abroad, where frankly we just haven't really thought about this. We've kicked the can down the road, we've provided £500 million here to alleviate an immediate pressure there. I'd like to see a long-term strategic plan for social care.
Well, Joe, thank you ever so much. It's been a fascinating conversation, hearing your journey in social care, your journey with Four Seasons, which has been quite a ride for, I think, all of us working on that project, and also your predictions for the time ahead. Thank you for joining us today, and here's to a great 2024 for all of us.
Thank you, Mike.